Okay. Hello, everybody. My name is Nathan Palamutam, and for this week's Expert Sciences meeting, we have Miss Marina. Sorry, what's her last name?
Dr. Chichelnitsky.
Dr. Chichelnitsky.
Marina Chichelnitsky.
Yes, and she's an ophthalmologist. So we're going to be learning a little bit more about that profession, and we'll start off with just the beginning question. How did you end up being an ophthalmologist?
Honestly, it was I can't remember because I've been in this specialty for many years. And I graduated in Russia, graduated medical school. And I always wanted to be a doctor, and I wanted to treat patients. But I was also inclined to be, to do exact, precise sciences. And in medicine, lots of things are just pure art and not science, unfortunately or unfortunately. Well, it's in my opinion. And ophthalmology is the field where we're very much dependent on art. Even anatomy, even optics, it's all mathematics related, optics related, physics plays a huge role in it. And that's probably why I decided to become an ophthalmologist. Somewhere in the middle of the second year of medical school, I was brought to observe cataract surgery, and it was amazing what people did. It's a microscopic surgery, which seemed to be. I'll tell you more about the surgery itself later, but this is I was amazed by it. I was amazed by results, and always wanted to become a surgeon since that.
Yeah.
That on.
And could you go in a little bit more depth as to what it takes to actually become an ophthalmologist, like what the medical school process is like, the undergraduate process, that sort of stuff?
Well, with any specialty in the United States, you need to go through, after your high school, you need to go through 4 years of undergraduate program, which should include pre-med. After that, you have to take special tests to become an MD, to enter medical school, which takes about 4 years, and you then get a medical degree, medical doctor degree. So this is 8 years of training. With ophthalmology, you're supposed to do 1 year of general internship to kind of learn all other aspects of medicine, internal medicine, different other specialties. And then to become comprehensive general ophthalmologist, it's another 4 years of training where you're learning about different areas of the eye, and you're becoming comprehensive ophthalmologist. That's not it. After that, if you want to specialize in a certain part of the eye, which could be anterior segment of the eye, you would think this is such a small organ, but still, you can become a subspecialist in taking care of a very small segment of the eye. And for that, for retina specialists, for example, it requires additional 2 years of training. For glaucoma specialists, additional 1 year of training. So, and you can have multiple subspecialties as well. So another definitely 8 years of pre-med and medical school, and then internship and 3 years of regular training. But if you would like to become more specialized, it's another from year to 3 years. So this is a path most people take to become specialized within an ophthalmology.
I see. Very interesting. And I think with most people, they don't really understand like how complex the eye is and why it takes so many years to truly understand how the eye works and how these surgeries work. So could you explain maybe like what the hardest thing you had to study for the eye, and maybe like something that's pretty complex about the eye that took a long time to understand that many people might not know about?
Well, I even brought the model for you. I don't know whether you can
wow.
see it. Can you see?
Yeah, I do. Yeah.
Model of the eye. Well, this is a huge model, but regular eye has the length of 24 millimeters. That's in average. And being such a small structure, it's so specialized. This is a part of a neural system. So when you're learning about the eye, you're learning part of the central nervous system, because the retina, the inner lining of the eye, which then comes, all the parts of the retinal cells come to the point where optic nerve is. Is it visible? Are you able to
Yeah,
see?
I can see it. I can see it.
Yeah. So optic nerve leads to the central nervous system, goes to your brain, which processes everything, all images you see, basically everything you see. So this is a very complex structure. The optic nerve has more than 1 million of nerve endings, then which goes to the optic nerve and then ends up in the being in the brain. Again, we need to deliver all this information about your vision to the central nervous system, and we need to process it. And processing, you need to, how we see those images, we see different colors, we see differently at night. All those are aspects and parts of the central nervous system processing the information, which is delivered through the anterior segment of the eye, through your cornea, clear part of the eye, through the pupil, which is the hole in the middle of the eye, refracted in the lens of the eye. This is the clear lens, and then comes to the focus in the retina, and retina processes those images into the beginning of the optic nerve, and optic nerves goes to the central nervous system, to the brain, where it first crosses in the chiasm, which is the first part of the central nervous system, and then goes through the different aspects of the brain, and occipital zone, the back of the brain, is the end point of this processing. So this is very complex. I'm giving you physiology and anatomy over 3 minutes, but this is why it's not even though it's a very small organ, it takes that long to learn about it, and then to work on each and single part of the eye if you want to treat any kind of eye conditions. And there are different eye conditions. Some eye diseases affect the front portion of the eye, and some eye conditions affect back portion of the eye. Most of the conditions related to the eye are most common conditions and leading parts of the blindness associated with age. But some are congenital, some are infectious, or they happen because of the injury. Many different issues which could happen with this small organ, and each one requires special attention.
Yeah. And then obviously, like what you said, there's a lot of things that could go wrong in the eye. I think we explained that the most common type of surgery was the cataract surgery, but in your experience, what's the most difficult surgery that you had to perform?
Well, I'm a cataract surgeon, so majority of my surgeries are cataract surgery. So I deal with elderly people, because as I tell my patients, cataract is not a disease at all. Cataract is a normal aging process. If we live long enough, everyone would have wrinkles. The same with cataracts. If people live long enough, they would have cataract. And that's the only surgery when we remove cataract, vision, if everything else is normal, vision goes back to normal. So this is the only surgery which defies age. That's why I find it completely fascinating. And so the surgery is performed on this part of the eye. This is the lens, which is completely clear, and you can see that see white part of the pupil, and it's that's why the image, all images go through. But when we get older, lens become opaque, like this. So we need to do something about that lens to make it clear again. And you know, in 600 BC, were first cataract surgeries performed. And they were performed, I think it was in India, by a very interesting way. The person was just placed flat on the ground, and two people were holding that person. And so the surgeon or whoever was performing that procedure went in with a needle. Again, two people are holding the patient so the patient doesn't move. And with the needle, this lens was pushed inside the eye. So the pupil became clear. That's how initial surgery was performed many years ago. Now, last century, this cataract surgery has come through tremendous changes with development of technology, development of new lenses. So we don't just remove that cataract, we put an implant in place of this cataract. So when lens is clear, when it's not the cataract in young people like yourself, this lens carries about 20 diopters of power. So if we just remove that unclear lens, then people would wear lenses very thick to correct their new refractive error. And that's what was happening initially when cataract surgery in the semi-contemporary way was developed in the 19th century. But nowadays, when we remove the lens, we put a small implant in. It's very small. I don't know whether you can see it. It's in my lipstick. It's about 6 millimeters. Hold on, 6 millimeters. Optical zone is small legs. Can you see it, or is it hard to see?
Yeah, I can see
It's very small, and it has the power of the lens we have to implant. So in contrast to old times when people had to wear lenses when cataract was removed in 19th and beginning of 20th century, now if you wear lenses, if you wear glasses, after cataract surgery, you don't have to wear any glasses because this plastic lens will be calculated to the power you need, and you will have perfect vision. And like I said, this is the only, even though this is not a disease, it's a condition of aging, the only surgery we have in the whole medical armamentarium is this cataract surgery. When we remove it and put the lens in place, if you don't have any comorbidities, any coexisting conditions, you will be seeing back to normal, to 2020, until you're 100, 110, or until you die, basically. Yeah. So this is why I love this surgery. This is a fascinating surgery. And sometimes people ask me, I do a lot of those. Some people ask, oh, they're all the same. What we do, we just go in through a very small incision at the end of the cornea, through 2 millimeter incision, go inside. New machines were developed last century, and the ultrasonic or laser machines, which emulsify cataract inside the little bag it's in, and the same machine suctions it out, and then we put that plastic lens with the power calculated for a specific patient. So, and the procedure takes about 10 minutes or 8-10 minutes. So it's very quick, and next day or the same day patient can see, no matter how poor the vision was prior to cataract surgery. Again, if there are no other diseases.
Existing conditions.
Yes, coexisting conditions. So this is the, some people were asking me, are you doing the same thing every day? But this is not true. This is a microsurgery. It's done under microscope with a huge magnification, and all four extremities of the surgeon are busy. I have that ultrasonic machine, which is called fake emulsification machine, in one hand. I have another instrument in another hand to kind of move the eye, and both of my feet are on the pedals, one for the microscope to control the focusing, and one on that ultrasonic or laser machine. So it's very complex, and no surgery is the same, even though we do them a lot, and it's like fingerprints. They're not exactly the same surgery, and that's a challenge. It's because every single, I don't know, tenth of a millimeter move or wrong breath, and you can have complications because you're working within a very small space, working with a 2 millimeter depth space. So all the emotions are very important and challenging.
Yeah, definitely. That makes sense. And with a job like this, what is the work week consist of? Is it extremely busy, or do you have some time? This is obviously like after residency. So when you're a doctor, how busy is it?
Well, it depends. It depends on where you would like to go. I am working in a multi-special group, which means we have lots of different specialties physician, and I am the only ophthalmologist, so all patients are sent to me from internal medicine physicians within my group, which has currently 80 physicians. So my practice is very, very busy. I operate once a week, and I do from now I do about 7-8 surgeries, but I used to do up to 15 surgeries on that day. And other days are clinic days. That's where I see other conditions, and plus that's where I kind of recruit patients for that cataract surgeries. And during those days, we see 40 patients. And this is a very, very busy clinic and sometimes stressful because you need to deal again, like I said, majority of ocular eye diseases are associated with age. Well, there is a pediatric ophthalmology, but it's a very small area because our common conditions besides cataracts are glaucoma, age-related macular degeneration, and those are conditions of older people. More commonly, they're happening after the age of 60. So you need a lot of patience because it's a little bit more difficult to take care of geriatric population. You need to be patient, you need to be understanding, you need to be compassionate. To me, it's very important. That's what I like about medicine, besides, like I said, technology of my field. But I like to communicate with patients, and I consider myself, I don't know whether maybe it's me, but I consider myself sometimes they're psychiatrist too, because like I said, 80% or 90% of my patients are geriatric patients. So they share with you, I think you shouldn't be going into medicine if you don't like taking care of patients, not just doing surgeries, not just the technical things, but also enjoying being again, compassionate. Empathy is a very important part of medicine, no matter what field you choose. And my patients share with me their stories, their sadness and their gladness, and that's why what I enjoy about my profession too. And challenging things, yes, challenging things are, well, sometimes very challenging surgeries within my small limited field. Like I said, I'm an experienced cataract surgeon, but sometimes people are afraid to do surgery, so they wait for too long until they cannot see it all to do it, to become, to have cataract surgery done. And with these current techniques I described to you, it's, it was easy to do with couching, with the needling and putting the cataract back on the floor of the eye. But the current techniques, they're not performed easily if the cataract is hard as a rock. So those are my most challenging cases when they're trying to convince patient that it's time to do it. And when they decide when it's too late, then it's really stressful for me. Another is, as any surgery, it's considered to be most successful, when you sign consent form, it's the most successful surgery in the whole medical field in terms of complications rate, but still they do happen, those complications. And that's why it's very difficult. Another stressful thing, another challenging thing is when you do cataract surgery on someone who has one eye. So this is much more stressful for me than doing binocular patient, because your responsibilities are much higher. Your one wrong move, your complication may cause real blindness. it. So this is a very stressful and challenging cases.
Yeah, definitely. Yeah, that really makes sense how doctors have to show empathy if they really want to get into the medical field. It can't just all be about surgeries. That's very insightful. And I think a lot of us should take note of that. But the last thing that I wanted to ask you, and it's just something that I ask all of the professors and doctors who come on here and speak to our club, what can high schoolers do if they're interested in this profession and want to get more into it?
Well, I'm strongly convinced because I've been thinking about that a lot for my own sons. And to choose one profession, you have to, and you have those opportunities here. You should go and be exposed to that profession. Don't just decide, oh, this is fascinating, and I'm going to pursue that. I think it's very important to try to shadow something, be it medicine or even within the field. Like some people prefer academics. After all the everything we discussed with you, they would probably not enjoy being in a clinic like mine, which is just a, well, I shouldn't call it routine, but this is just a front line, so the ophthalmology. But some people like research. They would go into academics after following all the steps we've discussed, because they like researching and maybe they like less hands-on communications with patients. So I think it's a very good idea, especially during your last years of high school, or maybe during your first 4 years when you're pursuing your bachelor's degrees, going and exposing yourself to different kind of specialties. It doesn't have to be medicine, right? But it has to, you have to shadow something and see how the day goes to decide whether you like it or not. I had my friend's son who followed me to the surgery, and he was observing me doing surgery. I thought it was fascinating how cataract surgery is done. He was there for the first time. And upon leaving, he said, no, I'm not going to do it. You do the same thing over and over again. So this is not for me. He was deciding on what specialty to choose within medical field.
Yeah.
So after seeing that, he decided against it. So it's very important, I think, for all of you to be exposed and to know what you are getting yourself into, whether you like it, or maybe you'll find something when you're more exposed, when you learn about something, you learn whether you have it in you or you want something else.
Yeah, definitely. All right. Thank you so much. This is a very insightful talk. And to everybody who's listening, if you have any more questions, feel free to message me, and then I can pass it on to Dr. Chitsvetsky. Sorry.
It is okay.
And if she has time, she'll respond and I'll get back to you. All right. Thank you so much, everybody. And thank you so much, Dr. Chitsvetsky.